Joining us for this week's Your Health segment is Dr. Jacob Wynes, instructor of orthopedics at the University of Maryland School of Medicine and podiatric surgeon at the University of Maryland Medical Center Medical System. Doctor, thank you for being with us.
Thank you for having me.
I want to talk about part of the body that has a lot of moving parts in it and causes people a lot of problems. What's the most common issue you see?
In the office, a lot of it is actually heel pain. The good news is, over the course of 11 months, 90% or more of it goes away on its own. However, there are certain things that we can do to help alleviate that. A lot of it comes down to stretching, icing, injections, inserts, and very little of the time does it ever require surgical intervention.
Heel pain meaning somebody's walking and it hurts every time you put your foot down, or just in a resting situation it hurts?
Yes and no. So the one that gets worse with time, that is the one that usually requires a greater degree of acuity and much more attention. That could be a stress fracture, that could be nerve impingement, that could be other issues related to other tendons and muscles that interact around the ankle. But the most common we see is something called post-static dyskinesia, which is just a big word for pain after periods of rest on that first step, particularly in the morning.
How do you avoid that happening? Is it a result of bad footwear, bad posture, running, something like that?
A little bit of both. Actually, what's interesting is that that actually comes from having a very tight calf muscle. Now you're wondering, how does a calf muscle affect the heel? What's fascinating is that you have the calf, which has two muscles, which then make up the Achilles tendon. The tendon doesn't exactly stretch, but the muscles can. If the muscles in the calf are tight, the band of tissue on the bottom of the foot has to stretch even more. And when that has to stretch, that causes pulling. And that pulling hurts right where it inserts on the heel bone. So you'd imagine when you're laying down or getting up from being still, your feet are down, the calves tighten up, and you get that reflexive stretch right away when you take that first step. And that's when that ouch sort of hits.
And we talked about stretching being a solution to treatment. It's that muscle that we're stretching out?
Exactly. And it's amazing how important it is to educate people on how to stretch. Stretching is not a passive exercise. Stretching has to be a very active exercise in that you're not concentrating on strengthening the calves, but you're actually pulling back enough that you feel some resistance and allowing those muscles to stretch out to alleviate that tension on the bottom of the foot.
It must be great to be able to treat somebody where they come in with a problem and you have a simple solution that doesn't involve needles or cutting or pills.
That is exactly why I love my job. Usually get the patients in and they walk out.
That's great. Let's grab a phone call. Prince George's County. This is Thomas. Thomas, thanks for the call. Go ahead.
Yeah, my name is Thomas West.
Sir, what's your question?
My question is, I went to the military in January 23rd of 1977, and I got thrown out of the bed because I didn't get up on time in the military, but I went on and graduated and served 22 years, 6 months, 2 days, retired. And I had a lump on my head, and I went to work, and I had 2 strokes.
Thomas, we want to wish you the best. We appreciate the phone call. When you think about somebody's feet and the way feet have evolved, we don't think about it too much. You probably do. They didn't evolve to be in shoes, particularly shoes with a high heel. Is that a problem?
Yeah, for the same reasons that we discussed. A lot of compensation happens from this infamous tight calf. They say that this tight calf phenomenon is called equinus, almost like a horse being equine. And what's interesting is managing this equinus, some people believe that it can be the root of all evil and a primary source of treatment, such that when you're wearing heels, particularly if you're a female or a gentleman, depending, when you wear heels, it's very important that, particularly afterwards, that you give your calves a very good stretch. And what that will do is that will also prevent a lot of the sequelae that we see. Increased pain on the ball of the foot, increased splaying of the toes. You can get this plantar fascia type symptoms that we described with that heel pain. All that can be a consequence of the way that you're walking in these heels. And it's amazing when you watch, particularly my wife, who would wear heels, and then when she comes out of the heel, she's walking on her tiptoes. And you wonder, well, why that is. It's reflexive. And what happens ultimately is when you're unable to put your heels flat on the ground, you tend to walk outward. in order to compensate for that. So I think stretching is very important.
Interesting. Let's try another call. Anne Arundel County, this is David. David, thank you for the call. Go ahead.
Yes, I want to comment on heel pain. I had some problems with that some years ago. We used to play basketball on one night a week, Thursday night, just for your information. And my heel would hurt so bad when I would get out of bed on Friday morning. But what I found is that if I cut my basketball play down, the weekly basketball, but I put the cups into my shoes when it continued to be a nagging problem, and it seemed, I don't have any heel pain now. So I stopped the stress on my foot by discontinuing the basketball, which may not be good my cardiovascular, and I think they were simple Dr. Scholl cups, and I have no heel pain now. So that might be a tip that may help some of the viewers.
David, thank you very much for the phone call. Common story?
Yeah, it can be, depending on what the cause of the heel pain is. Sometimes you get a inflammation underneath of the fascia, or the ligament on the bottom of the heel, and the bone, and that can be called a bursitis. Those situations do really well with heel cups. And these viscoelastic sort of polymers or these gel pads that can offload the pressure on these bursas, kind of like you would get in your elbow or your knee. You could also develop these little friction bubbles that accumulate, particularly as you sleep. And then again, that can explain why you have that first step of the morning pain as well.
Is there anything that happens this time of year, in terms of, one, we have winter weather, two, we have the holidays, that winds up in your office?
Yes. Fractures from slipping on ice, falling off of a ladder with calcaneal fractures or heel bone fractures, gout after a night of potential overindulgence, particularly when you have either fish, high protein, or alcohol. I see also issues with sprains and even puncture wounds from ornaments and other things that are around the house as people are getting ready for the holidays.
Be careful with the ornaments. Any other tips before we go?
No, just basically it's important to get a shoe that fits. Make sure you have at least a half inch of space ahead of your shoe. Make sure that your shoes are very rigid. Make sure you avoid barefoot, especially when you're walking on uneven terrain. If you're around the house, just be aware of your surroundings, avoid hot food, and avoid anything from falling from heights.
Sounds like a good plan. Dr. Jacob Wynes of the University of Maryland Medical System. Doctor, thanks for coming by.
Thanks for having me.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.